It could be a decoding problem, like meaning you read the question, you're not exactly sure what they're asking. So just analyze the scenario and say, where was it in the scenario that I should have seen to get the right answer, right? And just keep practicing. Cool. All right. So we'll read this question, you and I, side by side. I'll read it and love for you guys to share your information here. Here's a smiley face. You could put your information. You could put your any intel you like. I read no matter what, even though it's a short scenario, I still read the last 2-3 lines. Others will say, it's short, I'll go to the top. That's perfectly fine. I don't like to change every routine. So I will read the last 2 lines, no matter how short it is, and go to the top. That's how it makes me more comfortable, because I don't want to change style. So physical exam shows swelling of the right. So we'll read the last 2 lines, right? PE shows swelling of the right leg from ankle to thigh. Okay, so right. So there's swelling in the right leg from the ankle to the thigh. Okay. There is no erythema and or rash, neither. Which of the following? So there's no erythema, no rash. Which of the following is likely to be most helpful in establishing the diagnosis? We'll go to the top. 3 days after undergoing lap chole, a 67-year-old man reports swelling and pain in his right leg. Okay, that's important to know. He was diagnosed with colon cancer 1 month ago. Temperature is 101.3. So you should realize by now, by reading the last 2 lines, not only do you automatically stay in routine with your questions, you also are able to read the last question to find out exactly what they want. They want to know the most helpful way to establish diagnosis. And then when you see me go to the top, reading the top to bottom, I ended up reading the last line twice. It minimizes my chances of misinterpreting the question, misreading the question, not knowing what the question's asking. Okay, ladies and gentlemen, looking at the answer choices, what do you think the patient has, first of all? And then based upon what you think they have, what is the answer choice? So you say, well, I mean, I see that there's swelling and there's pain, in the lower extremity. I see that there's fever. Couple things come to mind. Now, all these answers look pretty good. We have a D-dimer, TTE, CT palm angio, blood cultures, and compression ultrasound. Okay, so we first need to know what the patient has. And that's why I love using AMBOSS, because AMBOSS gives us an opportunity when we're not working together to figure out if we're on the right track or not. So I realize that there's some valuable information here. I really feel that this person most likely has a DVT, right? I mean, that's what DVTs usually happen in the leg, by the ankle, warm, tender, swollen, painful. Okay, DVT. Plus, they had a recent surgery, right? I mean, they had a lap chole 3 days ago. So I think it's a DVT. Do you think I has a DVT? Yes or no? You decide. I then hit the attending tip and say, well, okay, I'm on the right track. So patient has swelling, pain in the right lower extremity, fever with no erythema, using the well score, which don't worry about the well score now. Please don't even worry about the score for now. You could read up on it later. Now, main concern is, did you know it was a DVT? Are you aware of signs of DVTs and how then to diagnose the patient, right? So now we have a DVT, pre-test probability is at least 3 points.